no reason, like, to not be here for this. Like, like Jeremy said earlier, like, it's such an impact. Like, we see the pictures, we see the inside of the mouth. Like, we never attach, like, the face and the person. Like, you know that that's what it is, but until you hear somebody come and talk about your treatment and talk about how it affected your kids and your life at home, it solidifies everything that we've been learning, and it just makes it that much more important.
Yeah, there's more to a diagnosis than just the ulcer, than just the cancer. There's your quality of life, and you don't hear how that gets affected on a slide or talking about the symptoms or talking about what we should be looking for. I mean, there's a reason why we need to learn what to look for, because someone's quality of life is greatly affected by us not knowing the symptoms, by us not, doing our part as future dentists. And yeah, it's time to make a change. I mean, we have to be willing to look for every sign so that, people, less and less people have to go through what you went through and less mistakes are made.
Right.
Yeah.
In Ken's story, Dr. Fornatura was saying that he was probably misdiagnosed, that it was probably not thrush.
Oh,
because he had it in the one area.
Yeah.
But they kept telling him it's thrush, it's thrush.
Right. No. Yeah, we need to hear the mistakes so we know, how not to make them. How to, if we don't know, maybe, if we're unsure of ourselves, send it out. If we don't, get a second opinion. It's all about, let's get communication going. Have the oral surgeon and general dentist talk to each other. Make sure the biopsies are being looked at by an oral pathologist. I mean, so many mistakes were made with your case that we can hear as dental students and make sure that we don't make them in our practices.
Yeah, also I think there's a big misconception lately where students go in to become a dentist because, oh, I want to make the money, I want to, have a good life for myself, I want the nice car, I want the nice house. But really what it is you're going to this profession to take care of people. Like, that's why you should be here, is to take care of a person. So to hear that they don't have an hour to fit into their schedule for you to come and talk as a person who's gone through this, as somebody that we're supposed to be taking care of, that's ridiculous.
Yeah, it's just
It's ridiculous.
It's really
That's
unfortunate.
really what it comes down, like, we're supposed to be taking care of our patient, not memorizing 100,000 facts about biochemistry and things that, we need to know them, but in the real world, they mean nothing.
Yeah, we're not concerned about the person behind it.
Yeah, and that's the truth. And I think that there's a huge misconception when it comes to dentistry lately.
Right.
And that's one thing that, like, I learned from my grandfather is, like, you always put your patient first. And that's what I will live by. Doesn't matter if I'm not making money. The money's great, but that's not what it's about.
And they say the health of your mouth is really the health of your whole body.
Yeah.
But I think still most dentists don't go out into the world thinking that they're going to save lives. They go in thinking, they're going to give people a beautiful smile.
Right. Cosmetic. It's, we're not real doctors.
And that's right.
But it's, I mean.
Is that changing here in the dental school?
I hope
I
so.
hope, yeah. I hope so. I mean, it's nice to give someone a smile, but wouldn't you rather give them their life?
Yeah.
Yeah, absolutely. But I also think that dentists fall short because they don't educate patients about the value of their services. In other words, if I know that you are going to find all kinds of diseases by taking care of the oral tissue, not the teeth, the tissue, I won't be canceling my appointment with my hygienist.
Right.
I'm going to be making my dental appointment every 6 months, but until you better educate the patients about your services and how important they are, the value of them, things won't change.
That's actually a great point, because when I was working as a receptionist and you'd call patients to come in, they'd be like, I clean my teeth, I don't have any cavities, I don't feel anything, I don't need to come in. And you're like, but you do.
Yeah.
So, yeah, I mean, that would have been a great thing to be on the phone with them and just say, like, listen, it's not just about your teeth.
It's about your oral health, which is the window to the health to your whole body.
Absolutely. Absolutely. Yeah.
Well, it's great talking to you. I have a gift for both of you.
Thank you.
There, could you get me those 2 books up there? Thanks, Ken. I've written children's books to help children understand cancer.
That's great.
So
Yeah, that's really
I'm
awesome.
free to do.
Oh,
She
cool.
might want to become a pediatric dentist.
Yeah, I'm
Oh, do you?
all about pediatric education and getting into various places, you know, like elementary schools, daycares, and like teaching oral hygiene from the very beginning and getting everyone excited about it.
That is really
That's
important.
sort of, yeah,
huh?
that's like what I get passionate about. So yeah, I'm really excited to see this. That's great.
And I guess the same goes true with the early symptoms of oral cancer or,
Yeah,
you know,
absolutely.
periodontal disease.
Absolutely.
I mean, they have to know if your gums are bleeding, you need to get in.
Right. That's yeah.
Bad sign.
Yeah.
You know, a sore that doesn't go away.
Yeah, bad sign. Yeah. Right. There are certain things, you know, we think about this with every other part of our body. You know, we've got like a cut that's not healing on our arm. Okay, let's go show the doctor. We're not feeling well. We've, you know, like got a headache and a cough. You know, let's go to the doctor. But for some reason, our mouths are totally overlooked. And, you know, I don't think any of us
We
really
still
realize
have that separation between dental and medical.
Yeah.
I was just
Yeah,
gonna say that. I think it's
And-
starting to change, but I think
Right. You hear a lot
it needs
more.
to change a lot faster.
Yeah, right. You hear a lot more talking about medical doctors and dentists having more of a relationship with each other.
Because you know, a lot of ready care doctors should really be trained in oral cancer because all those people out there who don't go to dentists
Right,
and they have something
Right.
in their mouth, they go to ready care.
right.
Those physicians have to be trained in oral cancer, and dentists are hardly trained, so we're really falling short in educating the medical community as well.
Yeah.
But
Yeah.
one day,
One day.
I'm very hopeful.
Yeah, one day, and we're the future, so hopefully we
That's
can
right,
help
you're
bring it
the
on.
future, that's right.
Yeah. Great. Yeah. Thanks so much. Oh my gosh.
Thanks.
Yeah.
Thanks for staying.
Definitely. Thank you.
for
Yeah.
coming and
Yeah,
talking to us.
and thanks for letting us be a part of it.